Whoa, where's the nose? Operating theaters, burr holes, and what the heck is catgut? Today we are reacting to and breaking down all sorts of old school medical procedures and devices from the Knick. Fair warning, medicine has come a long way since these practices and it might get a little messy. All right, let's dive right in.
When you wake up, you'll be cured.
Oh, what is he doing? They're wearing like crazy all white. At least they're wearing gowns back in this time, but taking place in like the 19th century, I believe. Later on, they realized like, hey, you know, the bright lights of the OR plus everything else, it was causing eye strain. And so they actually changed the colors. So it actually would be less strainful on the eyes. He's not wearing a mask, not covering his hair. Nobody else is. Oh, what the heck is this? Where's the gloves? Okay, so obviously not wearing gloves back then. And look at his arms. He actually has what we call track marks. Not sure if he's rubbing an alcohol, like cleaning agent. Not exactly sure. Oh, don't do this. So hopefully that was a topical anesthetic. Oh, cool. He did probably some sort of venous cutdown. Normally, we would like be able to stick an IV in the vessel, tubing, and get it to it. He was able to get directly into the blood vessel that he needed. As a surgeon in a hospital, you're not going to do these type of blood transfusions. We have blood stored and we have emergent blood in the military or out in the middle of nowhere. This is probably still happening to where people can actually transfuse themselves if needed with somebody else's blood.
Pulse is rapid. Pulse is weak.
Pulse is rapid. It could be related to blood pressure starting to go down, so your heart rate's trying to increase. And then if there's not any good enough blood volume going around in your system, the pulse is going to potentially be weak. And then that basically means your blood pressure is low. As that continues to happen, you basically can lose pulses. Ooh. All right, so those are different clamps just to stop everything from flowing.
What's happening?
It's not working.
It's not working.
I have no pulse.
Whoa, body rejection. That's so sad. Hopefully they had the ability to test back then, maybe not. And they're just taking a risk that this is going to be okay and compatible.
As you can see, my assessment is correct. As the brain's fluid is immediately being forced out through the opening syringe.
Oh my gosh, that's called a burr hole. There are different clinical ways to check for intracranial pressure. We have CAT scan machines that help us, but back then, imaging wise was limited. Had to use their clinical judgment, and then it's kind of like, I hope I'm right. What is this? Oh, he's sucking it out. Oh, super cool. You got everybody watching. So this is like a surgical theater. Obviously, we don't have these anymore, except sometimes in an OR, there'll be like a glass case high up where people can sit and watch to learn.
I know I'm supposed to cut something, but what?
But they're outside of the area because it's sterile.
In order to keep the intracranial pressure at bay,
Cool.
it is my opinion that the hole I've just created should remain open even after the operation.
So super cool. Yes. So there is called a craniotomy and a craniectomy. Craniotomy, open a hole, you take off a piece of the skull and then you put it back on. Versus a craniectomy, you remove the bone. You could save it for later. You can preserve it. Just relieving the pressure at that point may help instantaneously, but the brain might still be swollen for a multitude of different reasons. So it needs time to have the swelling go down. Whoa, where's the nose?
Is the light still too much?
What?
You've got good capillaries on the bridge and healthy skin on the edges.
Looking at the nose, looking at the blood supply, because if you give a new nose to that area and there's not blood supply to perfuse that new tissue, the new tissue won't take it. It's going to die. It's going to rot off. It needs to have good blood flow to the area. Obviously, the nose is super important for multiple different reasons. Experts believe that the sympathetic and the parasympathetic nervous systems are affected by the tissue within the nose.
You're a good candidate for restoration, but it won't be an easy go.
Very little has been.
When he means restoration, meaning like trying to fix it with something new. You know, there are different ways that you can do this. You can use your own tissue as a tissue flap, but you need a structure there. You need cartilage. This is all what plastic surgeons do nowadays. They do a lot of reconstructive surgery versus just cosmetic surgeries.
The surgeon selects a piece of skin from your arm here. He then makes a flap which stays partially affixed to your arm to keep the skin alive and provide blood flow from that end. He then attaches the other end of the flap to the bridge of your nose, attempting as best he can to connect a good blood supply.
Oh my gosh. Describing basically a procedure where you don't totally take the tissue off and then attaching it to your nose. So I'm assuming you bring it up and as it's trying to make sure that you have good blood supply and tissue adherence. That's actually pretty interesting. I've seen procedures where somebody has missing tissue, skin, and they need skin. They'll open up a wound in the abdomen, put it in so it actually can get nutrition and blood flow. And then when they have time and enough tissue, they'll actually take that off.
Vacuum.
Vacuum, all right, what are they gonna suck out of there? So it's on the lateral aspect, distal femur of the thigh. The major blood vessels are running right behind the femur bone on that side.
Christ, the bullet's lodged in the tunica. It's the only reason he hasn't already bled to death.
The tunica intima is the innermost layer of the veins. Maybe it's actually lodged in that. So he found a bullet in there. If the bullet is causing a problem like this, yes, you're trying to get it out of there. You can't just leave the bullet in a vein. If the bullet was just in the muscle itself, probably just leave it in there if you couldn't get to it.
It's already showing signs of necrosis.
Showing signs of necrosis, decreased blood flow to the tissue, whitening of the tissue kind of swelling a little bit, dying. There's multiple different stages, but the biggest thing is probably lack of blood flow to that area.
His pulse is eccentric. We need to amputate now.
So describing that his pulse is abnormal is a sign potentially that he is getting worse. That's why they're suggesting the dramatic nature of doing an amputation.
'Tis but a scratch.
To save him, even though you can't save the leg. Oh! Those are like bone cutters, I guess. So he cut off pieces of the bone. So sometimes we'll do that, fingertips that have come off and the bone is actually sticking out further than the tissue. You can't close the tissue. You need to cut the bone pieces off and we call that rongering and the tool is called a ronger.
Thread me up a length of catgut.
He is requesting catgut sutures, which is suture material or strings made from twisted intestine from sheep. Catgut sutures have pretty much been replaced by synthetic forms of it. Still really cool that they were able to figure out how to use that and that they're absorbable because it's mostly collagen. Very impressive. Now he's able to sew the wound up. Hopefully he saves his leg. I love this. I need to watch this show more often. So if you guys really enjoy this and you want me to do more, please let me know in the comments. And as always, check out this playlist right here. Make sure you subscribe, turn your bell notifications on, and hit that like button. Thank you so much for watching, and stay healthy, my friends.